Effingham.
My Lords, I beg leave to ask a question of which I have given private notice. The question is as follows: to ask His Majesty's Government what assessment they have made of the impact on jobs and growth of Merck's decision to cancel plans for a £1 billion research site in London.
Merck or MSD's decision not to progress its investment with 126 jobs lost, and I'd like to express my sympathy to those individuals, is part of a broader effort by MSD to optimise its resources. They announced in July that they would cut $3 billion per year by 2027, and 6,000 jobs would go worldwide. MSD continues to employ over 1,600 staff in the UK across other operations, including more than 40 collaborative working agreements with the NHS, our Future Health project, and UK clinical trials. We will continue to work with the sector to unlock growth.
My Lords, I thank the Noble Lord the Minister for his response. But the cancellation of the Merck research site is not only a major blow for our life sciences economy, it cuts across many other sectors that work with Merck in accounting, law, banking, and other professional services. It is a blow for research scientists in training, as those future job opportunities have disappeared. So how would the Noble Lord the Minister respond to the feedback from one of the largest pharma companies in the world that the UK is not making meaningful progress towards addressing the lack of investment in the life science industry?
The decrease in funding for the life sciences sector in terms of NHS purchasing of medicines started in 2015 and has continued since. It has not been a good position. We are reversing that now with a life sciences sector plan to make sure there is proper investment. $2 billion are going in as part of that plan. There's already 500 million gone in for manufacturing investment fund and 600 million for a health data research service. The changes we're making will continue to make this a place that people want to invest, but I reiterate that the loss of these jobs and the research centre of Merck is, of course, very disappointing, part of their global cuts.
We saw that AstraZeneca were relocating to Ireland. The Health Secretary walked out of talks with the industry in August, my lords, on the voluntary pricing scheme for branded medicines, my lords. And now we're seeing this kind of cancellation by Merck, my lords. Doesn't this call into question the whole of the government's VPAG policy, which has seen payback rates for new medicines unexpectedly surged to 22.9% in 2025, my lords? What are the Irish doing that is right, my lords, and this government should emulate?
Well, I thank the Noble Lord for raising the VPAG scheme. The VPAG scheme, which was negotiated under the previous government, turned out with a figure of 23%. Which was completely unexpected on both sides. So industry had entered the scheme jointly with government, negotiated it, and that's the number it came up with. What we've been trying to do is to negotiate a better position so that industry gets more from that and isn't hit with 23%. That's what's the deal going on at the moment. We're trying to make the environment better for companies and rectify something that ended up in the wrong place.
My Lords.
I think it's our turn on these benches. Go on, you go ahead.
Although this news is obviously very disappointing, can my noble friend say something about the bigger picture here? Because my understanding is that a number of other companies are continuing to invest here, and our dedicated life science action plan is being widely welcomed across the sector. So could he update the Lords on those issues?
Actually, let me just start by thanking the Noble Lady and thanking her for her work over the past year as a minister in two departments, which I think she did brilliantly. There are indeed other companies investing. It's worth looking at the same period. Moderna have invested $1 billion in the UK. BioNTech have invested $2 billion in the UK. There's significant growth going on in isomorphic, one of the latest companies doing AI drug design. So I think there are numerous examples where companies are investing. We do have a life sciences sector plan which has been welcomed by industry, And we do know that as part of that, the commercial environment for medicines in the UK needs to be improved.
Potentially the best location for life sciences investment in Europe, but it is undermined at present by the lack of agreement over the rebate under the VPAG, the Voluntary Pricing and Access Agreement. Would the Minister and the government enter into mediation now with the industry rapidly so that this can be resolved?
Well, I reiterate my points about VPAG. It ended up in an unexpected place. I think it was negotiated in good faith by the previous government and industry, and the result was not the one that anyone expected. We are negotiating to try and get that in the right place. We got to a very close to a deal. That's clearly now complicated by a number of factors, including, of course, the prospect of tariffs from the US. We continue to talk to the industry very regularly on all of these matters.
The decision by Merck is disappointing, but I'm encouraged by what the Noble Lord the Minister has had to say about the way in which the government's approaching this. And isn't it the case that the botched Brexit deal and the failure by the previous government to raise levels of investment has left us in this rather invidious position? And this decision stretches back more than the last 14 months. It's something that was left to us by the previous government.
Well, I think there's no doubt that Brexit had an effect on the entire sector. It also had an effect on academia. It also led to us ending up with very much reduced income from the Horizon Europe programme. So there was a significant effect there. And it is true that the decrease in NHS uptake of new medicines as a percentage of the total has decreased, and that decrease started somewhere around 2014-15 and has been relentless since. That has been part of creating an environment which is not conducive, and part of why, as the life sciences sector plan, we're determined to support R&D, to support company formation and growth, and determined to make sure that the NHS is an adopter of innovation.
Unfortunately, contrary to the bigger picture just painted by the Noble Lord, the Minister, the actual picture is one of a 50% decline in investment in life sciences in the last few years, the loss of 3 major investments, AstraZeneca, Eli Lilly and Merck, and the fact that 35% of the drugs that are available on the continent of the newest drugs are no longer available or are not being made available in the UK. The unfortunate situation is that the Treasury is only looking at this as a saving to the NHS and are not considering the wider impact on drugs for patients, valuable UK jobs and the life sciences industry. So my question is, has the Treasury performed a cost-benefit analysis which looks at all of the costs to industry, to patients and to business versus the NHS savings? And if yes, will the Noble Lord the Minister commit to publishing it? And if not, will he commit to commissioning one as soon as possible before we lose any more jobs?
Well, I thank the Noble Lord for that question, and it's a point I agree with, that this is about the overall economic picture as well as the health costs. And I do think that is something that we need to look at as we think about the way medicines are used in this country. I do think that the macroeconomic picture is different from the simple health economic picture, and it is something that is a very active part of discussion. It's something I've discussed with macroeconomists and looking at ways in which we might think about introducing that as part of the system.
I'm
grateful. Given the changes announced in the United States in the last year about their approach to medical research and pharmaceuticals, has the government made any assessment of the gap that is widening in the US in terms of other countries being able to fill the gap, particularly for medical research? And is there a plan? Because this, of course, is a global marketplace. And unless we are quick, other countries will soon take up the slack that America is creating.
I think we shouldn't be under any illusion the US is the major powerhouse in pharmaceutical research and development and will remain to be that powerhouse. And despite some of the changes, there is an enormous investment going into particularly the private sector R&D in the US. But the Noble Lady is right. There is nonetheless changes in the public sector funding, And as I hope the Noble Lady will be aware, we launched a £112 million global talent scheme, 54 of which came from government, the rest from the Royal Society and the Academy of Engineers, looking for global talent to get to the UK, because we believe this is a time when we can attract global talent into our leading universities and our leading biotech scene.
When I visited the excellent Chase Farm Hospital last year, I talked to the pharmacy and they had a lot of shortages of particular medicines. I've experienced the same in the local pharmacy. Is this a problem that the Minister's concerned about?
The shortage of medicines is always a problem. I mean, we can't have a situation where essential medicines are not available. That speaks to better understanding of supply chain resilience. And the Noble Lady will be aware the issue of supply chain resilience came to the fore very much over the last few years, when it was obvious that most countries didn't really understand their supply chains. A lot of work has been done on understanding supply chain, a lot on making sure there is resilience for essential medicines. And of course, there are opportunities there in terms of how the UK can work more closely with Europe to ensure that we get better supply chain resilience.
My Lords, the Noble Lord the Minister will be aware, because I've raised this issue with him personally. When I was a Life Sciences Minister, I wanted to work with other parts of government who were involved in life sciences. And when I asked my private office to do a survey of government, they found someone in the Treasury, someone in Number 10, someone in DIT. And what we insisted then was that all people in government working on life sciences should meet together so we could have a coordinated approach. I understand those meetings did not continue after that, and I know I've raised this issue with the Noble Lord Minister. Have those ministers recommenced, and when's the last time all the relevant people in government on life sciences last met? The second question is about the VPAG or VPAS. Once again, one of the things we could do is, given that many of the people who negotiate for the drug companies or pharmaceutical companies have actually worked for the NHS, they will understand the challenges on both sides of the table. And I wonder whether you could ask the industry for some blue sky thinking, given, especially from those who have worked in the NHS, understand the pressures, but also are now working in private industry.
I have indeed tried to continue the brilliant work of the Noble Lord on bringing together parts of government in this, and I met with people from many different departments as recently as yesterday on this. We are joining up the life sciences sector right the way across government. On the point about blue skies thinking, that was exactly one of the things that we've done with the industry leaders, to say, could you think about the most imaginative way to come up with answers to some of these? And we did get a piece of work on that, and we will continue working with them. There are indeed people from the NHS working in industry and people from industry working here. And of course, I have quite an extensive background of understanding the pharmaceutical sector.
Would the Noble Lord the Minister just follow on from my noble friend's comment about... yes, sorry.
My Noble Lord, but the Noble Lord was not present at the start of this debate, and
I was actually in the doorway coming in, so I'd be grateful to ask the question if that's possible. I'll leave that to you. My noble friend Lord Markham raised a very important point about the Treasury's view of how these pricing processes function. The reality is, if we don't have the drug companies in this country, we're not just going to miss the opportunity for investment, we also lose the opportunity for clinical trials for our patients and individuals in the NHS to actually get access to these new medicines. I'd like to return again to the question about an assessment of the overall cost of these measures and a proper assessment of the understanding of how investment from the biopharma sector in the UK actually adds up, not just in relation to pounds, shillings and pence of the sort of medicines.
Yes, I agree. This is a key area. It's one that I'm working on. It's one that I've worked on with macroeconomists. I think it is something that we need to look at. We care about the industry in this country. We've got two of the world's largest pharmaceutical companies based here. Our largest company is a pharmaceutical company. Those companies are absolutely essential, and they train most of the people that end up working in SMEs and startups. They're the reason we have such a flourishing life sciences sector here. And we need to look at the expenditure not just in terms of a narrow health economics perspective, but in a broader economic perspective.
Business of the House, Lord Kennedy of Southwark, on behalf of the Lord Privy Seal.
My Lords, with the leave of the House, and on behalf of my noble friend Baroness Smith of Basildon, I beg to move the motion adding her name on the order paper.
The question is this motion be agreed to. As many as that opinion will say content. The contrary not content, the contents have it. Questions on an answer to an urgent question asked in the House of Commons yesterday on the implications of Israel's strike in Qatar.
My Lords, of course, it's important to remember that Israel has the right to self-defence under Article 51 of the UN Charter. And yesterday saw further strikes by Israel, this time on Houthi targets in Yemen. Of course, we know that the Prime Minister met with Israel's leader, President Herzog, yesterday. So could the Noble Lord the Minister tell us what was discussed in that meeting and what practical steps the government is taking to contain the growing instability in the Middle East?
I thank the Noble Lord for